Fertility fears are one of the main reasons men seem to be skipping a COVID-19 vaccine. University of Miami researchers have been studying this issue for months now. And Dr. Ranjith Ramasamy, a reproductive fertility expert, joins us live to talk more about this. Welcome to Houston's Morning Show. Is there any reason to think that this vaccine could cause a fertility issue in men?
Sure. So the primary concerns came about because there was a risk of the actual COVID virus causing impaired fertility. And the COVID vaccine, as part of the studies, no safety studies on reproductive toxicology were performed because of the emergency nature of the disease and the vaccines needing to get emergency use authorization. So that's where really the concerns for whether these vaccines could affect fertility came from.
Now, can you talk to us about what vaccines you were able to test?
Sure. So we tested the first two vaccines that came out. So just the Pfizer and the Moderna, both of which are the mRNA vaccines.
Now, what about female fertility? Were you able to study that?
We did not study that, but a recent study actually showed women who underwent assisted reproduction or IVF cycles, and women that got vaccinated versus those that did not. There was absolutely no difference in pregnancy or live birth outcomes that happened after that.
Well, I think that would be a huge relief for anybody who's in childbearing age and got the vaccine. Maybe they've been concerned about that. Now, let's talk about COVID itself. Have you been finding out and hearing and seeing studies that show that COVID could actually lead to a fertility issue?
Absolutely. So we've done our own studies where we have identified the COVID virus that's present in the testes of men long after their initial infection. And we have shown that in the initial acute period between 3 to 6 months, that the COVID virus can actually affect sperm counts and cause a decline in the sperm counts at 3 to 6 months.
Now, that's a scary thought. What about affecting the sperm in any other way? Would it damage it where it might cause an issue with the baby? Or are you just seeing a smaller count?
So I think we're just seeing a smaller count.
Okay.
I don't think we have studies where we have done the quality of the sperm and the DNA of the sperm, but certainly that's something that needs to be explored in the future with the virus.
Now, what about erectile dysfunction in men? Because we know it's an uncomfortable subject, but it's real and it affects a lot of people. We're just now hearing that it could also be a symptom of long COVID in men?
Absolutely. So we actually did studies here at the University of Miami looking at the COVID virus and electron microscopy in men who were undergoing a penile implant. And we actually found that the virus was present in the penis about 7 to 9 months after the initial infection. This we were very surprised about because we didn't know how the COVID was able to evade the immune system, get into the penis after a long time. But we actually found that the COVID affects the blood vessels, and blood vessels that supply the lung, the kidney, also supply the penis, and they seem to affect the blood supply to the penis, leading to erectile dysfunction. So yes, men need to be aware of this condition and try to avoid getting COVID or try to get vaccinated.
Just when you think you hear it all about COVID, something new comes about, and that is, it can be very devastating for couples. Thank you for taking time from University of Miami to talk to us about this today and just make people in the know and better educated certainly helps along the way. Good to talk to you.
Absolutely. Thanks, Melissa.